Let's carry on our discussion of communicable diseases and start with tuberculosis. Do you know the difference between a droplet route and an airborne route? Well, with COVID, you should know that. So a droplet route, the pathogen falls to the ground in large droplets. The pathogen doesn't make it very far from the source of the fluid, but if you intercept the drop's path, you can get infected. Such things would be the common cold and strep throat infections. In the airborne route, the pathogen is lifted up into the air inside tiny droplets. The pathogen floats and can move long distances with air currents. If you inhale this mist, you could get infected. And this is tuberculosis and COVID-19. So the good things about tuberculosis is the number of lives saved is 49 million lives have been saved through effective diagnosis and treatment. The bad thing is that we're having a difficult time with multi-drug resistant tuberculosis, and we saw that in the film last week, Bending the Arc. Drug-resistant tuberculosis is a growing health problem. Among those who test positive for TB and begin treatment, the default rate, or the proportion of people who are diagnosed but do not complete the full course of treatment, is very high. People who develop drug-resistant tuberculosis are at a result of defaulting on their treatment, put their lives at risk, and they also cause anyone they infect to have potentially life-threatening drug-resistant tuberculosis. Multi-drug resistant TB is a TB strain that does not respond to two or the standard antibiotic therapies. Multi-drug resistant TB can be treated using a directly observed therapy approach. It's called the DOTS approach, which we saw last week in our film with community health workers. But the medications are more expensive and the course of treatment is much longer, up to 2 years, rather than the normal 6 months of a normal TB that doesn't have drug resistance. The double trouble is the TB-HIV co-infection. It's the leading cause of death of all adults who are HIV positive and not on antiretroviral therapy. And that's because TB becomes an opportunistic disease where it takes advantage of the compromised host. And so WHO recommends testing all HIV people for TB and all those with TB for HIV. The vital role of nurses in TB care and treatment is paramount. This was taken from the International Nurses Day in 2017, and just looking at the role of the TB nurse globally. What about tuberculosis in Canada? One of the required readings for this week is a statement by Stephen Lewis, which was delivered at a press conference. He's the co-director of an AIDS-free world. He was visiting Nunavut and actually did a statement on what he saw there with respect to TB. He said there's a TB crisis in Nunavut. 14 out of 25 communities have active or latent cases. Many are children. Treatment requires medication for 9 months, and TB is 100% curable if we can get it before people develop drug resistance TB. Nunavut is an area that's very difficult to maintain and oversee the regimen, like the DOTS program. The land mass is 2 million square kilometers, and there's not enough nurses, especially nurses trained in TB. Of the nurses that are available, there's not enough Inuit nurses, and so they rely on nurses from the south. These nurses typically come for a 6-week rotation, and they don't speak the language. He makes a comment, with the best will in the world on the part of the nursing profession, how do you keep track of the subtleties and complications of a disease like tuberculosis if you can't speak the language of the people? Point 3 is the colonial inheritance. So just making note of the destruction of language and culture lies at the root of every Inuit struggle, including tuberculosis. Point 4 is the social determinants of health. Time and again, throughout his travels, he heard of food insecurity. He heard of excruciating poverty, He heard of nothing in the fridge, but above all else, he heard of housing. None of it is a minimum of 5,000 houses short. Not only is there a desperate shortage of houses, not only are many units of housing in dreadful disrepair, but the overcrowding is unbelievable. And with overcrowding comes the transmission of TB. Number 5 is that the Inuit history is unknown. We know of the horror of residential schools. We know of the missing and murdered Aboriginal women, Indigenous women, and the baby scoop in parts of Canada between the 90s and the 60s and the 80s. And so just not knowing what has happened in their history to make them more at risk for TB. And so the role of the nurses, what do you think? And that's what our third lesson is going to be about, is looking at what is our role of nurses in communicable diseases, and think about what your role might be in trying to decrease the rates of TB in Nunavut. Next, I'm going to move on to malaria and neglected tropical diseases. So malaria. Malaria is a life-threatening disease. It's caused by a parasite and it's transmitted to people through the bites of an infected female mosquito. It's preventable and curable, and the WHO African regions carries a disproportionately high share of the global burden of malaria. It starts off with the first mosquito bite, infects the first person. The liver becomes infected and it infects the red blood cells and people become anemic. Along comes a second mosquito which bites the first individual, and that second mosquito goes on to infect a second person. Pregnant women and fetuses are at high risk of anemia and death from malaria. 12% of stillbirths in sub-Saharan Africa can be attributed to malaria. Vector control is the main way to prevent and reduce malaria, and that's done through insecticide-treated mosquito nets and indoor residual spraying. We bring mosquito nets with us when we travel to Ghana to ensure that all villages and all individuals living in villages sleep under a mosquito net. Diagnostic testing is very easy. The WHO recommends diagnostic testing for all people who are suspected of malaria, and this is the test that we use. Treatment is based on which mosquito is infecting the population. It's basically called a drug called artemisinin-based combination therapies, and it will typically prevent and cure and kill the lethal malaria parasite. There are some insecticide and drug resistance that has been found, and so that has been a problem with treating malaria and trying to prevent malaria, is because of this changing insecticide and drug resistance. One idea that's been looked at is genetically modifying mosquitoes to ensure that they can't breed. And so it's mosquitoes that are genetically modified and sent out into a population that has high rates of malaria. And when these mosquitoes breed with the female mosquito, it prevents them from developing or carrying the parasite. The last piece I want to talk on is neglected tropical diseases. These are a multitude of diverse group of communicable diseases that we haven't discussed here that prevail in tropical and subtropical conditions in almost 150 countries. And they affect more than 1 billion people and cost developing economies billions of dollars each year. They're most common in the worst, poorest people without adequate sanitation, and those people who are coming in close contact with infectious vectors and domestic animals. And so you see this often in areas where there's poor water and sanitation and there's infections in the water. And so it impedes child development, and it harms pregnant women, and it can cause long-term debilitating illnesses. And so I'll put up a link from WHO of some of the more common neglected tropical diseases that are known. And so this was just an article in The Guardian stating that if treatment was provided, it could lift 1/6 of the population in our low middle income countries out of poverty because the enormous impact that it has on these individuals. So we're going to stop there, and we will come back and discuss antimicrobial resistance in our next lecture.